Hi, and welcome to Infertility Unfiltered, where fertility experts and warriors are joining forces to provide you with tips, tricks, information, support, and inspiration so that you can take back control of your life and get your baby on board. Hi, I'm Jennifer Robertson, and today we are so honored to be joined by Dr. Jordan Robertson. Now, Dr. Jordan is a naturopathic doctor, a medical researcher, and best-selling author of the book Carrying to Term, which we're going to talk about today. She's host of the Women's Health Unplugged podcast as well. After experiencing recurrent miscarriages, Dr. Jordan combined both research and medical experience with her passion for helping couples achieve the pregnancy they dreamed of. And as I said, today we're going to be talking all about miscarriage and her book, which is an amazing resource, and how we can reduce the risk of miscarriages. So I would love to hand over to you, Dr. Jordan Robertson.
Thank you so much for having me.
Now, before we start talking about miscarriage, you just want to tell us just a snippet about yourself and what led you into the path that you're in now?
Sure. Yeah. My background is actually what's called critical appraisal, which is when you research to decide what's true and really how to make clinical decisions from that research. So it's actually my background, which sounds ironic that I then became a naturopathic doctor, right? Because I think sometimes we imagine that maybe there is not the breadth of research for integrative medicine or lifestyle or nutrition as there is for other avenues in medicine. But I actually was really attracted to that style of supporting patients. I like preventative medicine. I like endocrinology and understanding hormones. I like working with patients on long-term behavior change and change in their lifestyle and nutrition and supporting their health and wellness. And I could do that in this profession differently than practicing in other areas of medicine. And so I chose that path, which has turned out to be sort of a beautiful, I'm not going to call it a calling, but I totally have embraced the role I get to play in my patients' healthcare, which I find very important. My background in being interested in fertility mostly started with my own journey. I think we all kind of women who are interested in fertility often have a personal story that connects them with this topic. And in my last year of professional school, or last year of naturopathic medical school, going into my board exams and then into my first year of being graduated, I actually had 3 miscarriages almost in a row. It was like 3 miscarriages out of 4 times being pregnant. The 4th time I actually had my son. So out of a year, I was pregnant 4 times. And with these miscarriages, I really became interested in how we treat women around miscarriage. I was sitting in the ER beside people who were, barfing into a bag, and I was like being treated the same way as them, right? Which I really found quite remarkable, that I was having such a emotional and really grieving experience in my life. And yet I was sitting beside kids with an ear infection and someone with the flu. I became really interested in how we approach miscarriage in general. And then when I started having recurrent miscarriages and realized that the kind of care that I deserved wasn't being offered to me, I became deeply interested in researching the topic. One was for myself, and I think I kind of got lucky in that 4th pregnancy, to carry my son to term. But I also really had to advocate for myself to get the kind of support and treatment I wanted. I remember my family doctor really poo-pooing the idea that I needed progesterone support during that pregnancy. And I was like, well, this is my 4th pregnancy in a year. And I distinctly remember leaving the office with my prescription, but in tears, that I wasn't being supported in the way that I knew from the research was the way that we should be supporting women. So that turned into sort of a bit of a passion project for me. And I started looking into, all of the risk factors for miscarriage, all of the conditions that would potentially put a woman at risk for miscarriage, the lab work and the assessment strategies that we should be doing, rather than what we do now is we wait until women have had 3 miscarriages before we get interested in them or curious about them. I became sort of deeply interested in how we could do this differently so that women didn't suffer or struggle with multiple miscarriages that maybe some, are unnecessary if we supported her a little differently. Which then turned into the book and turned into me educating and lecturing for my colleagues. And then that resulted in the creation of the book, which really is quite a practical guide for women to decide if she thinks she's at risk, and then what kind of steps she can take to be better supported by her medical team, and also things she can do for herself that help her reduce that risk.
And I think it's really important that we are able to have the resources that allow us to take a little bit of control back as well, because this is such a thing that is just completely uncontrollable. And a lot of the time we're censored. It's such a taboo subject. Like it's just not spoken about, and it drives us into shame and feeling like it's our fault, and we feel this intense amount of guilt. So can you talk about the book? We had a quick conversation about this in terms of like you've had to just rebrand it for a specific reason. Can you talk about that?
Sure. Yeah. When we launched the book in my naive way, I just was like, I'm just going to teach women in the world about miscarriage. And so the book was originally had the word miscarriage in the subtitle. It was actually called A Practical Guide to Reducing Your Miscarriage Risk. And this is my grandfather clock. It goes in the middle of every recording I've ever done is my grandfather clock. The book was called Practical Guide to Reducing Your Miscarriage Risk. And I put it up on Amazon. I was ready for it to be released to the world, which it did hit the bestsellers list in those first couple of weeks, which was amazing. But then when we went to promote the book and we went to try and encourage women to learn about the book, either through social media or whatnot, we found that the word miscarriage itself actually was a restricted word to use in social media posts and advertising. And so the feedback we got was that this was not a topic that we were allowed to promote, whether it was on Amazon or Facebook or whatnot, because they didn't want women to feel targeted and feel badly about their miscarriages, which I found so interesting because my goal in writing the book was to help that woman who's like crying on the side of her bed, not knowing what to do next and feeling so alone. Now that woman couldn't even look the book up because of the word miscarriage being in the book. And that's who needed it, right? Is that woman who's alone, suffering. And we had to completely rebrand the book to take the word miscarriage out, so it was a more searchable resource for women, so that we didn't limit the access for women to get that information, because it was being sort of censored.
I find that crazy, and we could talk about that so much. Like it's just the way that it is, and no matter what way you look at it, miscarriage is painful. And, I think trying to put it under the covers is, even worse. It even drives us more into that little shame bucket that we've got. But anyway, I'm glad that you've moved past that. I'm glad that you're back out there again. But it is really disappointing that we can't actually talk about it as something that is not, filled, dripping with shame. Anyway, so let's talk about some of the things that we can do to actually reduce the risk of miscarriage.
Okay. Yeah. And I think even tying into what you're just saying there around sort of like the shame piece and us not being comfortable talking about the topic, it actually leads into how do we talk to women about reducing their risk in the future? So I think one of the challenges that we face with the topic in general is that absolutely there is a subset of miscarriages that are, and I'm going to use the most dreaded phrase in a woman's fertility experience, meant to be, right? Or a non-viable embryo, a non-viable pregnancy. There absolutely is a grouping of miscarriages that fall into that category, that there is nothing that could be done. It is nobody's fault. It is just a product of that circumstance, and that, that miscarriage was destined to happen. But there's also a subset of miscarriages that I say we maybe could see coming a mile away. And that's based on underlying conditions. That's based on underlying risk factors in women. And the problem, I think, with this conversation is that we have put all of those miscarriages together in the same pot and said, let's not talk about any of them, right? We don't want women to feel bad, and we absolutely don't want women to feel bad, but we also want women to feel empowered and powerful and like they have control. And so I think separating those two conversations and saying, yes, there absolutely are some miscarriages that happen that we maybe couldn't prevent, but there are also some miscarriages that we need to talk about that we could put some control back in the hands of that couple if we educated them better about why and how those miscarriages were happening. And I think that's really important, because I think that's why we've, we haven't spoken about miscarriages as much as maybe we could or should. So
and I
for
think
me,
that's why also, like, once someone does fall pregnant after they've had a previous miscarriage, there's a huge amount of anxiety around it, because they're thinking, well, I have no idea what happened before, what I did wrong or anything like that. And I have no idea how to prevent it in the future because I have no idea what I did in the past. So it really can increase our level of anxiety. So if we can actually get to the root of the problem and do some things so that it may reduce our risk, then that would be amazing.
absolutely, right? Like, imagine if, like, sitting down with someone and someone could say, you know what, I can't see a reason why that previous miscarriage happened. Let's call that bad luck, right? Let's call that like a one-off, versus I can see things about the circumstance or situation that we could improve. And that means our next attempt at pregnancy would maybe be more successful, or at least that woman would have peace of mind that she's thrown the kitchen sink at the situation at the very least, right? I've never found a more motivated group of individuals than couples who are trying to start a family. So why would we keep that information from them when it maybe would have a really positive impact on their outcome, right? So the most important thing that a couple can do to start is actually just to be properly assessed. And although that sounds so simple, there are actual blood tests and diagnoses that help us understand your miscarriage risk. And I think this is a step we skip often in the fertility assessment. I say the very reason that a couple is sitting in a fertility clinic is the same reason she has an increased risk of miscarriage, or that they have, as a couple, have an increased risk of miscarriage. So whether a woman is in a fertility clinic because she has polycystic ovarian syndrome or endometriosis or low ovarian reserve or maybe male factor fertility, all of those reasons are actually heightening your risk for miscarriage. And so that needs to be part of the conversation. If you have a diagnosis that is impeding your chances of success with fertility, that diagnosis is also increasing your risk of miscarriage. And that's important because so much of fertility technology is focused on, I would say, like the main event of like ovulation, boy meets girl, right? And embryo development. But the reality is even if we take a really high grade embryo from an IVF procedure, we're still putting it back into that original environment. We're still putting it back into that woman. And I always say, like, at that point, we don't like technology. That's where the technology ends, right? We can do so many wonderful, beautiful things with, intracytosplasmic sperm injection and all like wonderful things up to a point, right? And then that embryo goes back into that woman. We cross our fingers and hope she doesn't miscarry. Where the reason we had to go about all of that technology is the same reason she's at risk for miscarriage. And we need to address her underlying situation, whatever that is. So if you have PCOS, we need to address the insulin and testosterone and hormonal issues that are coming with PCOS. If a woman has endometriosis, we need to address the immune dysfunction and the vitamin D deficiency and the inflammation. Because if your underlying circumstance isn't changed, we can throw all the technology we want at the embryo development, but the miscarriage part becomes a crapshoot if we haven't addressed like the underlying issue. Yeah. So the assessment piece is really vital because it can help us understand how to support a woman or couple to improve the odds of that part, so that we're not just like crossing our fingers and hoping for the best, We know that we've addressed the underlying reasons why that couple was struggling in the first place. It makes the technology more effective if we've, addressed those underlying things. So assessment is huge. And so sometimes couples I can't say like out in the wild, so not in a fertility clinic, may get pregnant easily on their own and miscarry. And so they may miss that assessment piece to help us understand if the woman does struggle with PCOS or does have endometriosis. So that really complete sort of fertility hormone questioning and lab work that can be done with a practitioner really is worth its weight in gold as we start to understand miscarriage risk. So that's always like the most important thing for me is the assessment part. And I can't tell you the number of times I've worked with a woman that, I keep picking on PCOS, but woman who has a diagnosed condition. And then when I say this condition increases your risk of miscarriage, she goes, what? Like, no, we've never even got that far in the conversation. We've been so focused on how many eggs, how many follicles, can I ovulate? When are we giving the trigger shot? And nobody ever even talked about like the second half of that.
Yeah,
situation.
I think the goal is just let's get you pregnant, and
Absolutely.
then we cross our, as you said, we cross our fingers.
We cross our fingers and we just kind of hope it works out. Yeah. And I think because that's partly where the technology ends, right? And it's coming. I think we're learning things about endometrial lining and hormones and the impact and how we can be more supportive for miscarriage. I think the research on progesterone has really certainly come a long way in the 11 years or 12 years since I was pregnant. Our understanding of it is certainly a lot better, but that's kind of where the technology ends. And so aside from supporting women with miscarriage or with progesterone, I should say, we don't have a lot of technology options to support her. And so, when we say it that way, it makes perfect sense why her underlying health is our most important sort of focus when it comes to miscarriage.
Mm-hmm. Okay. What are some other things that she can do once they've got that assessment? I guess that then drives the solutions or the things that they can actually be doing. So what's kind of one of the offshoots?
Yeah, one of the things, and so lots of that assessment is very like condition specific, right? But one thing that is like across the board important is actually your vitamin D status. So I know I'm still talking about lab stuff and assessment, but regardless of what we think your underlying risk is, and even if you don't have an underlying condition that's getting in the way of your fertility, vitamin D status has an enormous impact on miscarriage risk, even to the point of where like every point you are below what our optimal range looks like increases your risk of miscarriage by about 1%. So, we know that like in lots of countries and depending on where you live in the world, your sun exposure may not be enough to actually support adequate vitamin D levels, or if you use sunscreen, you may not have adequate vitamin D levels. For all couples, regardless of that underlying diagnosis, that is a huge way that women can change their outcome is just by addressing their vitamin D deficiency. Mm-hmm. Beyond that, we start to move into like, dietary and lifestyle solutions that decrease risk. Again, a lot of them end up being really condition specific, which we go into depth with in the book. But if we're to sort of like broad stroke and talk to women about what is ideal to help support them from a miscarriage perspective when it comes to nutrition, there's lots of things that are very positive. So, my general experience and the research suggests that very Mediterranean style diet is very supportive to fertility and supportive to miscarriage risk, where, abundant fruits and vegetables and olive oil and lean proteins and reducing saturated fat intake and reducing processed foods. That's generally the kind of like pyramid we're shooting for. But the one that comes up and is often surprising to women that they haven't discussed with their practitioner is the impact that alcohol intake has on miscarriage risk specifically. Mm-hmm. Just as a quick little story, if we have time for it.
Yeah.
In my very first year of practice, when I was super excited about what I knew about miscarriage, I actually landed a lunch date with the local fertility clinic. Where I got to present, what my role could be to support their patients with nutrition and diet and lifestyles that pertain to their fertility. And it wasn't solely focused on miscarriage, but it was focused on like how to support their patients in general. And I presented a study to them that showed that about 30 or 40% of couples still had alcohol the month of their IVF cycle. And so I showed them that just to say, you know, like we have some data to suggest that even something that we know that's having as strong of an impact as alcohol, which nearly doubles, or in some cases does double the failure rate of any fertility procedure. So whether we're talking about IVF or IUI, if either partner drinks in that month, their failure rate is double. So that it fails 2 times as often as if they didn't.
I didn't know that.
Yeah, it's crazy. Like it's a crazy impact, right? And you think like the amount of like emotional and financial investment that couples are making in an IVF, and no one mentions that they probably shouldn't drink, right? The 4 weeks before. But anyways, I presented this study and it had 1,000 couples in it, or 1,000 patients, I should say. So 500 couples. And it showed that 40% of them were still drinking. And I showed them this and I was like, I think this is important, right? This is something that we could easily be having a conversation with, and it probably would improve your outcomes in your fertility patients. And the doctors really poo-pooed the information, and they said, well, that's only 1,000 couples and our patients are better behaved than that. And I was like, okay. And I mean, overall, the whole experience was quite negative. And I actually write about it in the book. I talk about how I, you know, got teary in my car afterwards, thinking that I had something so great to offer their patients, and they were really disinterested in the impact of diet and lifestyle. Now, mind you, this was, 12 years ago. And so what we know now is a heck of a lot different than what we knew then. But interestingly, that same research group, like 2 years later, published a multinational center trial that actually looked at 15,000 couples. And guess what? 40% of them still drank the month of their IVF too. So we just like straight up are not having that conversation with couples about the impact of alcohol. But we also have learned that the impact is really real. And that's one that I would maybe suggest that if couples are looking for ways to try and improve their chances of carrying to term or decreasing their miscarriage risk, at the very least 4 weeks before, although we probably could argue that it maybe should be longer than that, but most of the research is just on 4 weeks. But that would have a dramatic impact on every cycle's possibility of success, whether you're in fertility care or not. So this is for couples in the wild too, that alcohol is really decreasing your chances of success and increasing your miscarriage risk.
Okay. Yeah. You're great piece of it. And it's something that doesn't cost them any money.
No, it probably saves them money.
Yes, absolutely. What else can they do? So we've got testing, we've got vitamin D, we've got diet, we've got alcohol intake.
And what else is there? One question I get asked often is around exercise, which, interestingly, we've done lots of research on what happens with professional athletes and Olympians when it comes to miscarriage. And I think people are often, especially if women have had a previous miscarriage, she's afraid to do a lot of things if she falls pregnant again, right? So, she feels like she should be on bed rest. She feels like, she shouldn't, breathe too hard because she may cause a miscarriage. That's a question I get asked often. The answer is actually that you can still exercise and you can still move. The negative impact of exercise and movement on miscarriage mostly has to do with oxygen flow and the amount of breath holding and how out of breath you are doing your exercise. If we think about it, when we exercise vigorously, all of our blood goes to our periphery or to our arms and legs to fuel our exercise, essentially. And that's really during that critical window where we're establishing that maternal fetal connection. We don't want to divert blood flow away from that process, right? We don't want to, and this is why PCOS causes miscarriage too, actually. A lot of it has to do with blood flow and vascular inflammation. So if women are lifting heavy repetitively, whether that's in their workplace or whether that's through training like powerlifting, women who are exercising above 70% of their maximal heart rate for long periods of time where they're out of breath and their oxygen levels are low, that's where we see the risk for miscarriage with exercise. But most women are not, exercising to that degree. We typically see that in a setting of like, Olympic training or like high level elite athletes, or maybe doing that on a more regular basis. But that's a question I get asked often. It's actually quite positive for women to continue doing her exercise through those first couple of weeks after falling pregnant, partly from a mental health perspective, to keep her stress levels low, but also just overall for metabolic health, it's better if she continues to exercise. But I will say I often meet women who, especially if they've had a previous miscarriage, that when they do get pregnant, they just like they just don't want to move. They don't want to do anything for 12 weeks. But you can continue to move. So that is one thing that, I often have to field questions about that.
Yeah.
Aside from that, like there are nutritional supplements that have been shown to support miscarriage or decrease risk of miscarriage. The challenging part is that it's really based off of a woman's like underlying challenges or diagnosis. Certainly we know a prenatal or good quality prenatal multivitamin is important. And I have already mentioned about the importance of vitamin D. But beyond that, there are studies looking at things like fish oil or N-acetylcysteine or inositol. And all of those nutrients are very powerful if they're warranted. Right.
So I think it's really important to emphasize the fact that they need to be tested in order to work out which for them. It's not just a matter of my girlfriend took fish oil, so I'm going to take fish oil, because it may actually work against you anyway.
Totally. Yeah. And I would say like there's certainly not a lot of harm in the things that, are on the table as far as the options for miscarriage support. But really need to be, discussed with a practitioner to make sure that it's the thing that is actually warranted, right? I think when nutritional supplements get a bad reputation for being ineffective, part of that is because they're over the counter, right? So we have people self-medicating for a condition they don't have at a dose that's not helpful, right? Or they don't take it long enough to see the effect. When really, if those things are well prescribed for you at the right dose and for the right amount of time, the research on nutritional supplements for miscarriage is actually very positive. It just has to be done like with some specificity, which certainly in the book, I do go through all of the things that are warranted for each condition. But I say really clearly, like, do not take this list to the health food store and buy everything. Like, that's not the right way to approach it. If you're that confused about what your needs are actually a really good practitioner, right? Not a huge pill case of all sorts of things that you're taking for miscarriage.
Absolutely. Now, what do you say to the woman who, so we know now that there are things that we can do to reduce our risk of miscarriage, but I am really conscious of, a woman having a miscarriage and then going, oh my goodness, and blaming herself because she didn't do all of those things, and looking back and going, oh my goodness, I had a glass of wine and I am the cause of my miscarriage. Like, how do you reconcile it back so that they don't use these things, so that they see them as something that they can do to prevent, but not something that they did to cause it?
I understand. Yeah, that's a challenging, conversation to have, right? I always kind of imagine that when I'm done working with women, that they're frustrated and empowered at the same time, right? They're often frustrated that they didn't have this information before, but feel empowered that they can actually change their future. Right. And so, we can't change what's gone on in the past. And sometimes those past circumstances lead us to understand what's going on with you. And unfortunately with miscarriage, like the more often it happens, the clearer things become in some cases. And so a woman's past experience, like even if I reflect on my own past experiences, my 3 miscarriages were like in the middle of my exams, in the middle of my board exams, and then the week that I received my board exam results, right? And so although they were traumatic, of course, all 3 of them, they really pointed in a direction that helped me understand what my future plan needed to look like, right? Around stress management and diet and exercise. And so we can use those moments and those traumatic instances to fuel our understanding of how to support women in the future. And no, it's absolutely not her fault, right? Because she was doing the best she could with the information she had. I want her to have better information, right? So that she can make an educated, empowered choice about what her future options are. If we're not having those conversations, she can never get to that place, right? Where she can never feel more in control. And I would say that that's like one of the most important things we do by educating couples around what their options are with fertility, is to actually just make them feel more in control, to make them feel like their whole body and mind is part of the process, versus us micromanaging her cycle and micromanaging the experience. But yeah, it's absolutely a difficult conversation to have. It's that like dichotomy of like frustrated, empowered. That's what I see often in practice, is women are like, well, why didn't someone tell me this before? Right? Like, why isn't this common knowledge? But also feel like, hell-bent on changing her future, which is why I wrote the book, right? Because I said, like, we don't have to have like multiple tiers in order to give you the information you need to change your future.
Absolutely. And I think it's time that we really stop censoring it, because that's what's causing all of this. Now, how can people get their hands on a copy of your book?
Yeah, so it's available on Amazon, both in electronic and in print version. It's Carrying to Term, or you can look up my name. I'm also prolific on Instagram and at Dr. Jordan ND, where do videos and things on miscarriage. We've got a couple of podcast episodes specifically on like some of the specific conditions with respect to miscarriage as well, which are searchable and easy to listen to. But the book itself is available on Amazon in both, digital and in hard copy.
Oh my goodness. It has been an absolute pleasure talking to you. As I said before, I am a complete fan of yours. I follow you on Instagram. You are completely empowering, not just from fertility, but as a woman. So thank you for all that you do. And thank you so much for joining us, Dr. Jordan Robertson.
Oh, thanks so much, Jen.
Okay, now if you love this interview as much as I did, please make sure that you give it a little love, share it, like it. Make sure you subscribe to this channel as well, because this is just one of many amazing interviews with amazing people as part of the Infertility Unfiltered series. So thanks for watching.